Very good morning to everyone present here. I, Sophia McConnell, the Organizing Secretary, welcome you all to Webinar Series 5 organized by Sri Abhirami College of Physiotherapy. It's a great pleasure to welcome our management, our chairman, Dr. P. Periasamy sir, our board of directors, Dr. Kundavi Devi ma'am, Dr. Senthil Kumar sir, Dr. Balamurugan sir, Dr. Uma ma'am, and Dr. Sucharita ma'am for being a backbone and making this event possible. I'm honored to welcome our guest of honor, Dr. Sudhan sir, Dean, Professor at Garden City University, Bangalore. He has been a great teacher and a mentor. I feel happy to host this webinar being a student. Welcome, sir. Sir has a wonderful topic in this webinar, especially in this pandemic situation where so many people are struggling with COVID and even those who have been cured and difficult to come back to normal life. So the topic of this webinar is physical activity and exercise immunity during COVID. I also extend my warm welcome to our principal and convener, Dr. R. Jayabharati ma'am. She has always been motivating and guiding us in everything we do. Thank you, ma'am, for your constant motivation and guidance. I now hand over the session to our convener. Ma'am, please take over.
Thank you, Ms. Sophia. Warm good morning to one and all present here. So I, on behalf of the chairman and board of directors of Sri Abhirami Group of Institutions, I welcome you all for the National Webinar Series 5 organized by Sri Abhirami College of Physiotherapy. And I extend my heartfelt thanks to all the overwhelming response to all the delegates who had registered for the webinar. So it gives me an immense pleasure and I am privileged to welcome today's speaker, Dr. S.G. Sudhan sir, Dean and Professor in Physiotherapy, Garden City University, Bangalore. Sir had been expertised in various fields like cardiopulmonary physiotherapy, exercise science or ergonomics, lifestyle medicine, dry needling, research, etc. He is the member of Secretary of Ethics Committee at the Garden City University. He has 17 years of teaching experience after completing PG. So SAD has more than 17 journal publications of high quality and 17 scientific presentations, including recent COVID-19 on lifestyle factors, which was presented at IAP in India, that is India webinar. And Sir has been has got various awards like Dr. Mokshi Best Teacher Award, Hostmet Bangalore November 2014, and Significant Contribution Award in the year 2015, and Young Scientist Award at Srinagar, Jammu Kashmir, Best Physiotherapist Award held in PhysioCon March 2017 at Nimans, Bangalore, and Professional Excellence Award, Physio Gala, May 2017 at Meher, Chennai, and Significant Contribution Award at 58th IAP International Conference held at Chennai, February 2020. So I behalf on the management, I welcome you, sir, for the webinar series 5 and organized by Sri Abhirami Group of Institutions. And today's topic is quite interesting and it's inevitable during this pandemic situation. Now I request Dr. Sudhan sir to take over the session for the webinar presentation. So please take over the session.
Yeah, thank you, madam, for that introduction. I'm very glad to be a part of this webinar series organized by Abhirami Group of Institutions, College of Physiotherapy. So I bring greetings to you all from Garden City University. Today's topic for presentation is physical activity and exercise immunity during COVID-19. At outset, this presentation is going to be very interesting, which covers the goals which are set by the WHO and United Nations for 2025 and 2030. Then how that is reliable, or it's relying on a physiotherapist in terms of physical activity, exercise, immunity, and the various policies which we need to adopt to overcome this pandemic situation and also in future encounters. Today, we live in a era where sustainable development has become inevitable. The United Nations as well as the WHO constantly have the upgradation of the goals. And this periodic revision, which is the latest one, talks about sustainable development goals. Now, what is this sustainable development goals? So these are focusing on using the resources very sensibly, not wasting it, and everything becomes more accountable. And we look for utilizing the available resource more meaningfully. So this is about the sustainable developments, and there are total 17 sustainable goals which are set forward, which covers various streams of development science sectors. Under that, the goal number 3, if you see, is good health and well-being. So this is where we directly come into picture, as well as there are other goals which we indirectly work also. So these goals, which are set by the world leaders, are giving an opportunity to refocus and renew efforts at promoting the physical activity. So they give so much weightage to physical activity, exercise, and because this is going to have a major link to the impact of health of the society, and thereby we are also going to see about the how much cost that it involves if we are not intervening at this basic level. The physical activity term sounds very simple, but it has a very, very important impact in the life of everybody. Now, the WHO has identified many sectors where health is one major sector. Other than that, we have environment, education, sports, and technology, which plays a major role in contributing to the SDGs. Apart from the SDG target, which is set for 2030, 10 years from now, we the NCD targets are set for 2025. Now, NCD is not the very recent thing which is being discussed. It has been there over many years, and the strategies are constantly evolving to sufficiently contain such developments. Now, the major NCDs, as you know, obesity, hypertension, diabetes, are directly linked to ill health. And now, in the pandemic situation, these are having a high influence and making the mortality rate very high. So, at this juncture, it is very important to understand that we have goals set by the world leaders, the United Nations, and WHO to combat the situation of a pandemic as well as the health concerns, and to improve the standard of living of the society. Now, do physiotherapists have real need to concentrate on SDGs? Do we have a role on it? So, if you ask so, really, of course, we do have a very important role in combating the health concerns that we face globally, and we do have a very, very important role. Now, this is one paper which you see, which is published recently, which says that there is a very important role that a physiotherapist has to contribute in transforming our world, and to achieve the agenda set by the United Nations towards the sustainable development. Now, it also calls for making health promotion and prevention rather than just being a curative aspect of a physiotherapy care. So, most of us are into the role of curative, which means rehabilitation aspect. But the situation now, the pandemic situation, has focused and also calls for a need that we involve ourselves in health promotion and preventive aspects. Now, what is this health promotion? Health promotion, it is not done somewhere else. First, it has to start within ourselves, that we need to think about strategies, the available resources with us, how we can influence the society. So through the any field that we are working, we may be in different streams of physiotherapy, but we need to focus on the available resource within our limits, how we can utilize those things to promote health. So, specifically, health in terms of combating non communicable diseases is what is the focus of my presentation today. Now, coming to the prevention part, we see that basically we have three levels of prevention: primary prevention, secondary prevention, and a tertiary prevention. So, we physiotherapists isolate and we more work on the tertiary prevention, that is, treatment and rehabilitation once some disease condition has happened, or some strain or some musculoskeletal issues has happened. Now, what is demanded of us is we need to focus on the primary prevention and secondary prevention itself. Now, what is this primary prevention? Is we need to prevent such diseases. So, the major non-communicable diseases, as what said, obesity, diabetes, and hypertension, we have a role in preventing. So, early detection right from the childhood. So, we need to isolate and find out and prevent the root cause, so that there is no disease or disability that we are going to face after many years as such. Now, that becomes a real burden situation for the local economy, the country's economy, as well as the global economy. So we will have better focus on things which we need to really focus, and if we take care in the primary prevention as well as the secondary prevention aspects of health. So this is the major point that I would like to stress. We need to concentrate on health promotion methods and preventive strategies, rather than considering or isolating ourselves into the rehabilitation aspects alone. Now, the areas that are not much explored in terms of prevention strategies and promotion is biomechanics, ergonomics, exercise, fitness, and there are many other streams which we need to look in for. So, because of the outreach from the physiotherapists is not there, there are other streams which are taking into the scope of physiotherapy, like the lifestyle medicine, which is recently growing up. They talk more about exercise. Then you have yoga, naturopathy, physical educational professionals, and other health enthusiasts. They talk and they are into the area or the domain of physiotherapy practice, because we are not taking steps to give inputs or scientific updates in those specific areas, or we are not really exploring it to the much growing demand that we have in the current situation. So we need to adopt to develop health promotion strategies, preventive strategies, and we also need to realize that we have to work on those lines. Now, we as a physiotherapist work in different areas of healthcare, or you are a researcher, or you are into teaching stream, or you may be into the fitness industry. Wherever we are, we still have a professional responsibility of upgradation and meeting the needs of the global guidelines. So we have to adopt to those sustainable development goals in the areas wherever we are. So that is how we put forward the profession in a healthy manner, and it is also focusing on the society needs. Now, the current situation of pandemic, people are running behind what to do, how we can prevent from getting infected, or how we will cope up with the situation. Now, exercise and the role of physiotherapist is very crucial, and this has to be brought to the society, that you increase your physical activity level, you are going to have a better immunity. Now, again, personal standards also matters. So personal standards, not in terms of just a professional upgradation, it also talks about our personal health, how you see health, how you practice health, healthy practices in our life. So that is a living example rather than we preach something to the society. So these three are very important aspects that we need to adopt. So the professional standards are brought up. So either we should redefine ourselves, or we should refine ourselves wherever we are, and to meet the standards of the sustainable development. So, having said this brief introduction about the current scenario that we are living in, and the goals that are uh, put forward for us to take up for 2025 and 2030 in terms of sustainable development, uh, my focus today here is to talk about physical activity and exercise and its role on immunity. So this is, again, I'm focusing on the good health and well-being, third point of the sustainable development. The scope of physiotherapy is very vast. It's not going to be sufficient for me to tell everything here, but I'm very much inclined. I'm be a person who is very much interested in exercise. I'm focusing more on physical activity and exercise as such. So I consider these as the tools of health promotion and health prevention uh, against non-communicable diseases as such, and the current pandemic situation also. Now, let me give a brief introduction about what is physical activity. So, physical activity, as you see, is any bodily movement produced by skeletal muscles that requires energy expenditure. Now, being active is more physiological for human body, and this is going to be very, very important in maintaining the health standards. So this can be adopted in a daily life practice while working, playing, or household work, traveling, engaging. So it is the movement that is very much needed, and this is all about physical activity. Now, the WHO has some very important findings that we need to think about. Is physical activity so important for us to talk about in this platform? You see that more than 80 percentage of the world's adolescent population is insufficiently physically inactive. Now, what does that tell us is it is a major risk factor for mortality and non-communicable diseases such as cardiovascular disease, cancer, and diabetes. Now, it is also forming a platform there where infection can take over easily. So when a physical activity is promoted, there are a lot of health benefits, and it contributes to prevention of NCDs. Low or decreasing physical activity levels often correspond with a high or rising gross national product, which means it is talking about the economy impact, which becomes a burden to the society that we are living in. So, reduce insufficient physical activity by 10% is the WHO guideline given for 2025. So, we need to understand the importance of improving the physical activity levels. Now, how much physical activity is recommended? Now, this recommendation, we find it in the ACSM guidelines, we find that in the WHO, and even our government, Indian government's national health portals, we find the similar guidelines which is given. So, a minimum amount of physical activity required for different age groups. Now, to just to brush up those, for children and adolescents aged between 5 and 17 years, it is around 60 minutes of moderate to vigorous intensity physical activity that is required. And they also say about a little bit of strengthening activities are also to be given. For an adult age 18 to 64 and above 65, almost the duration of exercise remains very much constant. Per week, 150 minutes of a moderate intensity physical activity is good. So, depending upon the individual needs, for an aged, you need more amount of balance coordination training. For age between 18 to 60, so you need a specific task training. So, all these are the guidelines which is given so that people start to adopt or develop an interest towards physical activity, considering the weightage of health benefits that it brings. Now, benefits as such, if we see regular and adequate levels of physical activity improves muscular and cardiorespiratory fitness, improve bone and functional health. So it controls the NCDs, it reduces the risk of falls, and it is a fundamental to energy balance and weight control. So when the physical activity is inactive, insufficient, it has a high mortality rate, and the NCDs tends to go high. So this is all well-known facts that I am sharing to you just to make you understand that physical activity is a very, very important thing that we are discussing about. Now, there are many factors which reduce the participation of people into physical activity. So the few environmental factors that people take excuse or people say are fear of violence and crime in the outdoor areas, high density traffic, and passive transport. Now, this passive transport is much prevalent in our modern metro society, where we spend most of the time traveling, and we reach the workplace and then again get back home. So this is not helping in sufficient amount of physical activity. Then there are also reasons quoted as low air quality and pollution, which prevents people engaging in physical activity, lack of parks, sidewalks, and sports or recreation facilities. Now, apart from this, the drop in physical activity is partly due to inaction during leisure time. So, this is individual based. So how much you incline yourself to participate in physical activity. So the though we find a lot of reasons, sometimes it are really sensible, we need to think about promoting the physical activity within ourselves as well as to the society, by introducing new concepts or methods how they can achieve physical activity even if situations are not right. So if suppose they are involving in the passive transport, or if there are no facilities, but still there should be some means which we can suggest them that they attain good physical activity. Now, this slide, I'm just going to discuss about a few important concepts about physical activity. Now, we interestingly find in the papers, news that more people are engaging themselves in physical activity, but now the percentage is rising, but it is unfortunately without a proper prescription and supervision. Now, does physical activity needs prescription? Walking needs a prescription? Yes, of course, we need, because this is where physiotherapist needs to intervene. So it is not just some professional saying you just go and walk for 1 hour. It is not the way of physical activity guideline to be prescribed. You need to think about the age, the underlying factors. If suppose a person is having a early osteoarthritis, you ask him to walk for a prolonged period, a daily 1 hour you walk. So your concept is going to affect his knee joint, and later his abilities is going to come down. So that's one example. Similarly, we need to consider the different age group and what are the other factors that will eventually give some benefit or not. So that has to be weighed, and this type of prescriptions is to be given only by a physiotherapist as such. Now, second important thing, on the right side, you see a graph. This is a Pew Research report, which is very shocking. Most of us think that our country is in the high middle, what to say, a global income group, middle income group is where we are. But this report says that the majority of population, almost 75 percentage of the population, still lie in the low income category. So now we only see in metros the establishment of gym culture, people coming to exercise, walk out. So the percentage of people that who we see in those categories are less than 10 percentage. So we need to address and devise strategies so that the major proportion of the population is targeted, and that is when we will be able to have much satisfying results in control of non-communicable diseases. And I also find that this is one of the reason that still physiotherapy or the exercise as such has not gained ground or recognition from the government sufficiently, because the population are still under the lower income category, and the percentage of population who heed to physical activity advices are very, very less. So this trend has to change. We need to incorporate or devise strategies so that we will be able to approach to every sector of the people. Then the practicality of the physical activity guidelines becomes possible. So the Indian standards, the concerns to the specific society has to be there when we prescribe or when we devise programs towards the physical activity. So only if we do that, the society can be influenced. Otherwise, it's just going to be a talk, and people listen and just go about. So this trend has to change. Now, second thing, on the picture on the right, you see. When you see the picture, people think about, oh, who she is. Okay, how is the picture? Quality is good, or oh, she's smoking, and you see how style the she holds that. But we very minimally look into the wordings that is given on the right end corner. Cigarette smoking is injurious to health. So because it has become a part of the regular thing which is happening, we don't really bother about it. So this is the scenario that we see towards physical activity. uh, People are not really bothered about, because it is, we are talking about something, so you may develop illness this many years later, or this is it. So the neglecting behavior towards physical activity should change. So we should develop strategies to inculcate people to realize how important physical activity and how it can facilitate health in them. So now, moving on to the next aspect, exercise. So synonymously, these two words are used by many. Physical activity is similar to exercise, but obviously not. So both are a different level of activities. Physical activity is just bodily movement where energy is expended, whereas exercise by itself is a structured program. So it is a subcategory, of course, of a physical activity, but it is very much planned, structured, repetitive, and aims to improve or maintain one or more components of physical fitness. So this exercise has to be the category where people has to be promoted. Now in the current scenario, people have to first of all adopt to physical activity. They need to understand the importance of physical activity and take part in physical activity. Just like that, it doesn't happen. We need to devise strategies so that we promote the society to involve in such aspects. Then comes the level of exercise. Related to exercise, I would concentrate on three important aspects now. So first is any exercise, you should remember that it should incorporate the principles. Now, without these principles, the exercise does not really becomes an exercise, or it still remains in the level of physical activity. So exercise has much more health benefits than the physical activity itself. Physical activity is good, but if you are able to do an exercise, it is much more good in terms of health benefits. So the principles of frequency, intensity, time, and the type has to be a major concern when exercise is being suggested to anybody from a physiotherapist end. Then, coming to the types of exercise more specifically, uh, I feel personally anaerobics should a little bit dominate, because why I say that is, most of us have difficulty in allotting time towards an exercise. And aerobics requires minimum amount, which is a bit prolonged, which most of the people of the low socioeconomic, as we saw, or a middle economic group may not be in a position to do it. So I would suggest, or I feel that anaerobic should be top. By scientific reasons, both are equally good in giving health benefits. So this, with a lesser duration, probably you can inculcate better health benefits. And of course, you should also remember that a mix up of aerobic anaerobic activity, which comprises of the flexibility, the strength training, everything should be a package which you give on specific days and specific timings. The exercise becomes more fruitful, and we can concentrate towards getting a health benefits. Now, very important thing here, exercise prescription is not a joke. So it is like similar drug prescription, which is done by allopathy practitioners or any other Ayurveda practitioners. This prescription is specifically done by physiotherapists. So we, as a physiotherapist, when we talk about exercise prescription, it should carry a specific uh, frequency, intensity, time, and type. Because if this is not followed, either the exercise just remains as a physical activity, or if it is an overdose, sometimes it may result in injury, which will deteriorate your pre-level itself. Okay, so I hope you understand that exercise prescription has a weightage just like a drug prescription, and it is not to be considered loosely. So whenever we prescribe exercise, we have to be very much sensible in prescribing, even to the patient category, or the category who are healthy apparently and who are looking for health benefits. To prescription clearly very much matters. Now, the next category of physical activity is the fitness. So, this is the supermost level where health and well being is a major concern. More specifically, the ability to perform aspects of sports, occupations, and daily activities. So, once the person starts to involve in exercise, they can be refined into the fitness level. Fitness has health related components and skill related components. The health related components, as you see, cardiovascular endurance, muscular strength, flexibility, and body compositions are the major things. And we can adopt to anyone. So it depends on the people's interest. It depends on their body conditioning. So you can adopt to any one of this fitness component, which will be again useful towards your specific daily needs as such. So that makes the exercise practice more sensible. So you are already exercising and you specialize, or you have fitness towards a specific task. So that makes you injury free, that makes you more healthy and more efficient in the work what you are involved in. Now, next is the skill related fitness. So, this involves agility, speed, power, coordination, reaction time, and balance. Now, everybody can be involved in this, every professional can be involved. Now, if you ask for physiotherapist, what type of skill related fitness do you need? I think everybody will say all of this we need. Yeah. So, at different walks of the physiotherapy practice, we definitely need a good amount of fitness for us to be recognized as a physiotherapist first, and to be effective and productive in the stream wherever we are working as such. So, just to brief now, the different levels of physical activity, the base level has to be promoted, and we need to incorporate people to participate in physical activity. The second, once we are into the physical activity, they have to get promoted to exercise strategies. They have to adopt some exercises, and later they can think about the fitness towards a specific task or their daily needs as such. So it doesn't matter whichever level we are in today, you can still start and achieve this very shortly. So you assure health benefits for yourself, as well as you ensure that the society is becoming very healthy. Now, coming to the next important aspect, the immunity. So, immunity in simple terms is a protection from disease. So, the current coronavirus cases have reached in millions, and the deaths also have crossed 1 million. Still, the other side, we see the recovery ranges also over 3 millions as such. Now, how does this people recover without sufficient vaccination or any other source? It is probably because of their immunity. So, immunity, it has been influenced by various factors, including your food or many other things. But here, what I would like to stress here is uh, about the physical activity, which has influence on immunity very much. Sure, do you believe it? Yes, let's see. Now, the comorbidities, as what we talked earlier, hypertension, diabetes, is again influenced by exercise. I hope everyone will agree to that. And this is a recent article which talks about reduction in the cardiorespiratory endurance and low stress tolerance and exertional fatigue is specific to patients with COVID. Now, exercise and physical activity have definite impact in reducing these symptoms in COVID patients. And this is a very good journal which talks about exercise, which is increasing the ability of the body to counter the different types of viruses. This is what we are looking for. uh, so you have a list number 3, which is specifying about coronavirus itself. So there are documented evidences which say that exercise and physical activity increase can definitely influence the viral activity, and it can control by improving the immunity level of one. And there are a sufficient amount of high quality exercise immunology data that exist in the research arena. It has There are a lot of been trials which has undergone with the military professionals when they go to extreme situations, how they combat the infections. So that is because of their physical fitness probably. And there are also researches done on athletes and general public. Everything says that exercise and physical activity has a high level of impact on the immunity. Now, the major mechanisms to discuss is the natural killer cells, which is commonly said, and the neutrophil and macrophages activity are increased with acute set of exercise. Even if you're just starting now, today you can have an increase in these cell activities, and it can improve your immunity. And the studies also say that the longer and more intense the exercise duration. So when we say about this, if you are practicing better physical activity levels and exercise for over a period of time, now maybe 3 months or 4 months or over years, your immunity level is definitely strong, and you are maintaining yourself or protecting against the viral influence as such. Now, this one study, which is very interesting, done on the athletes of varying age groups. Here you find on the graph that pre-run and post-run, there are significant amount of increase in the NK cell activity and other cellular activity it is found. And even on the third, fourth, and fifth bar that you see on the graph here, which talks about 1.5 hour post event 3 hours post event and 6 hours post event, which says there is a significant amount of raise in these cellular activities, and your immunity level is maintained high even after the event. So you see that 62 percentage at 1.5 hour post run, 57 percentage 3 hours post run, and 45 percentage 6 hour post run. So if suppose this is a study which talks about immediate bout of exercise and its impact on the killer cells. Now imagine if we are practicing healthy physical activity guidelines, as well as if we are practicing a good amount of exercise over a month's period, over a year period, how much your body immune system will be boosted. So this is just an eye opener for people who are really not into the physical activity or exercise. It's a call to you. We need to just definitely start these practice in our life. Now there are other mechanisms which talks about serum cortisol level, which is raising with response to physical activity and exercise. Neutrophil lymphocyte ratio is also found to be very high, and this is a very important concept which is discussed in most of the journals too, in the method of combating immunity. So with that, we see that physical activity, exercise, and fitness are the steps towards achieving better immunity against the invading virus, and the current scenario of the coronavirus. Still, it can help you. Now, we'll see about the policies, how we will be able to promote health and prevention aspects of this health. As I discussed earlier, improving the healthy practice, that is to promote, prevent, and adopt, is a very important strategy that we need to think about exercise prescription. Let me just discuss on a few statistics here. Here, this picture says about occupational classification of workers. These are categorized into three major groups: primary, secondary, and tertiary. You see that the primary sector is agriculture, and the third, tertiary sectors, is trade, transport, communication, banking, and other modern day health professionals that we are coming into. Now the data is up to 2008. I was able to trace. Now you see that the primary sector, which is considered as an agriculture, was 71 percentage in the 1950s. Now if we see in 2007 and 8, the data shows it is 55 percentage. Now, where does this 25 percentage move? They people have started moving into the secondary sector and the service sectors. So, why I am talking about this here is, now we need to understand the physical activity level reduction in people in percentages. You can imagine that the people are shifting from the rural setup to the urban setup, where the physical activity level is deteriorating. A lot of stress is involved, and this forms a very important channel for development of the non-communicable diseases. And this is where physiotherapists are required to concentrate and keep the physical activity level promotion, as well as exercise level and fitness level. All these has to be improved. So the data is not going to deteriorate. Now if at all you are interested, you can compare this percentage with the growing percentage of diabetics, growing percentage of hypertensives. So you will find this shift very much matching. So the intervention is very, very important at this stage to combat the current existing scenario of the coronavirus, as well as in the future we don't know what situations that we may be dragged into. But still, if your physical activity and your exercise immunity is improved, definitely you have a better chances of overcoming such situations with ease. Now, the other policies generally we see is only possible with the cooperation of the government sectors as well as the private sectors. which has to invest a lot of amount into developing the habit of physical activity. So, usage of cycling as well as use of walking areas, all this has to be planned, and it has to be a part of the daily activity. So this strategies cannot happen individually, but there has to be a change in the society as such. So the policy which we draft, if we are in an influential position, so it's good that we think about how to inculcate the activity of physical activity towards any of the aspects that we are uh, into. In the school age, so that is about 5 to 17 years of age, now more concentration is needed related to physical activity. So because this is the time that we can influence healthy behavior in them, okay, so that this is practiced lifelong. So, the quality physical education supports children to develop behavior patterns that will keep them physically active throughout their lives. So, this is a very important strategy I see, because once we develop, inculcate such an habit, it is going to remain in them throughout. So if that habit is remaining throughout, what does it mean? It means that the health burden is brought down. If suppose say 50 students of the 100 students batch is involving in physical activity willingly, it means that those many people are reducing the health burden, health cost that country is going to face or the society is going to face. So they are going to make a healthy lifestyle. So intervention has to happen at all education sector levels, be it a school or colleges. There should be some promotion in the towards health and well-being. Now, we also have to have concern for the society. So the development strategies by the corporations or the metros has to think about providing space for the people to have physical activity, not to be cramped. So there should be sufficient spaces to walk freely, to ride, to cycle, to do some physical exertion. So it should consider all age groups. So it is the geriatric population also should not be neglected, because that is one major group that India is facing, and in future the proportion of geriatric population is going to be very high. So physiotherapists also should think about bringing avenues where you can inculcate the physical activity in the different age groups. Now, last group is the labor and the workplace policies. Now, many organizations have different strategies towards physical health, because this has become a major concern by the United Nations and the WHO, as well as it is considered as a healthy practice. So, most of the campuses adopt to a better walking space and cycling spaces individually provided in connecting different blocks, or they have a group a session where the entire workers are pulled together. They have a session which is giving some physical activity, so that they are free from the stress and they are maintaining good physique, so that the productivity towards the work which they are doing is going to be very much high. And many campuses do also incorporate sports, inter competition sports, where the workers are made to participate in that sports. So it improves the competitive skills, it improves the physique very much more. And there are also policies where the worker, if they are having a good physique, they are eligible for a promotion, they are paid an increment, they are having a consider benefits, a package to go out. So the different policies are existing in varying sectors depending on the categories. But the more and more we encourage physical activity through the different streams, it is going to reap very high benefits towards the health costs that we are going to face. So, to before I conclude, I'm just recollecting what we have thought. uh, the rehab to prehab is the concept we need to evolve right now. uh, don't isolate towards rehabilitation alone. We need to think about prehabilitation. So you need to work into promotion as well as the preventive strategies of health promotion and prevention is the key way of success in achieving the sustainable developmental goals, health and well-being. Now, second important aspect is realization of the professional responsibility. We need to be realizing what sort of responsibility that we have in our hands. It is not just continuing some duty that we are in already. We should think about what strategies that we need to incorporate so that we promote health through the different levels of profession that we are in. And we should also always think about and have a concern towards the society. We need to promote healthy practices and we need to live the words. So it's not just saying you need to adopt, you need to be an example of how to promote health. Okay, so that we need to take care. And finally, most importantly, I would ask personal health care. So you need to have concern towards yourself, not just for saying to somebody. It is you understand that the physical activity exercise has so much health benefits and it brings immunity to you. Why don't we adopt it? So it should be a part and parcel of a day-to-day life in a physiotherapist. Okay, so if we are able to inculcate that, the change starts from us. So that should be the success to attain the goals set for 2025 of NCD and 2025 of the sustainable development. So, with that, uh, the future of physiotherapy relies on us. So, if we stick on to the previous policies on the existing methods of work, I think we will be lagging behind and we will allow the other professionals or other people to take up because we are not going to do that. So, we should realize what is our role, how we can influence the society. So, then definitely the future of physiotherapy will still lie within us and we will be able to take it to very high standards. So it is a time for us to define ourselves or redefine ourselves or refine ourselves. So anything can be taken. So with that, I conclude my presentation. So we should be able to attain the sustainable developmental goal together, as well as the rehabilitation of COVID-19 as proposed by the WCPT, and we promote health and make a healthy society. Thank you, one and all, for listening. Hand over to Dr. Jayabharti.
Yes, sir. Thank you,
Yeah,
sir. Thank you. Really a wonderful presentation which enriched all our minds, sir.
yeah,
So,
thank
like how to use the sustainable development of the goals and how to utilize the available resource and make use of it. Then the role of our physiotherapist and professional responsibility, like guidelines for physical activity and importance of exercise prescriptions, and how exercises increases immunity and preventing the this pandemic situations, and some few policies to increase the physical activity and the social awareness and the benefits of physical activity in schools, workplaces, and in labor places also. So it is quite interesting and it really enriches all our minds, and it is an eye-opening presentation. So it's really fabulous and spectacular. So thank you for accepting our invitation and sharing your valuable knowledge and time with us. It's really a mind-blowing presentation. Thank you, sir. Thank you.
Sir, we have a question. Can you please give us some tips on how to motivate ourselves doing the exercise regularly?
Hello, hello. warm good afternoon to one and all present here. I am Ms. Kalpita, coordinator of this event. It's my great pleasure. It's my great pleasure to deliver my vote of thanks on this webinar series 5 conducted by Sri Abhirami College of Physiotherapy. On behalf of Sri Abhirami Institution, it's my immense pleasure to thank our resource person, Dr. Sudhan sir, Dean and Professor of Physiotherapy Department in Garden City University, Bangalore. We are really enlightened with your knowledge and presence of valuable information and excellent presentation on physical activity and exercise immunity during COVID. I express my gratitude to our chairman, Dr. P. Periyasamy sir, Sri Abrahami Group of Institution, and Board of Directors, Dr. Kundavi Devi ma'am, Dr. Sendil Kumar sir, Dr. Balamurugan sir, Dr. Uma Devi ma'am, Dr. Sujrita ma'am, for constantly motivating us in every occasion. I would like to extend my sincere thanks to our principal, Dr. R. Jayabharvi ma'am, for her valuable guidance and support to organizing this webinar series 5. I also extend my thanks to our EDP department who are standing firmly for successfully completing this event. A heartfelt thanks to our students and delegates for active participation with their warm words and kind message. Thank you. And we move to the end of today's webinar. I request all the participants to kindly fill up feedback form after this session.
Sir, Sudhan sir?
Hello. Yes, ma'am. Sorry, I had some issue, so call got disconnected. Hello, hello, hello.
Yes, sir.
Yeah. Sorry, I
Yeah.
got disconnected. Unfortunately, my network issue. I
Okay.
can take questions. I couldn't listen to the last thing. Any specific questions I can take up? Yeah.
Yes, sir. There's a question.
Yeah.
We are asking for few tips, like how to do regular exercise. Any tips?
No, I'm not hearing you clearly. Can you repeat, please?
Can you please give some tips on how to motivate ourselves in doing physical exercise, exercise
Okay.
regularly?
Okay, fine. So that's a pretty good question. Now, how to motivate ourselves? See, first of all, we need to consider the health benefits that we have towards physical activity. Okay, so the more fit you are, the more healthier you are. And we also have a saying already: health is wealth. So, considering the weightage of things that we have against good health and fitness, automatically we should get motivated to do. So, it is not always a forced activity or something to be forced. So, it has to come from within ourselves. So, the moment you think about your health and your health concern, definitely you feel motivated to do. Yeah.
Oh, thank you, sir. Thank you. Thank you for being with us. And thank you for accepting our invitation. Thank you for your sharing your valuable knowledge and your time with us.
Yeah.
Thank you.
Thank you.
Definitely, sir.
Yeah.
Thank you.
Thank you. Bye.
Okay, sir. Thank you, sir.